So we're going to perform an ECG on this patient here. She is laying on a towel in right lateral recumbency. We're going to go ahead and apply the clips. And we're going to apply some alcohol to the leads. See that? We have our machine here. We've got it on. We're going to go ahead So on the ECG that I ran on that patient, you can see that it does have a normal sinus rhythm here. We have our P waves, Q, R, S, and then your little T wave is right here, and that is very consistent throughout. So this one's a little bit bigger. You have a P, Q, R, S, T. And you have all of your waves and intervals on here. So we are going to do a tear test on Miss Molly here. We're going to go ahead and bend at the notch while it's in the plastic. We're going to open it without touching the notch. And we are going to place this in her eye. Gently hold her eye shut. We're going to count 60 seconds. Alright, that is 60 seconds, and she is at 18 in her left eye, so that is normal. I'm going to do the same thing for her right eye. And she is at 17. So both of those are normal. Alright, So we're going to do a fluorescein stain on this patient's eyes. We're going to have a 3 cc syringe, our ophthalmic wash, our ophthalmoscope, and our stain strip. We're going to place the strip inside the syringe and then pull up the wash. So now that we have our stain made, we're going to go ahead and place a drop into both eyes. And we're going to flush the excess out.
It's okay. Oh, you called it. Good girl.
You did perfect. Okay. Now we're going to turn the lights out and look with our ophthalmoscope, first with the regular light, and then we're going to switch it over to the blue or the green light to highlight the stain if there's any uptake.
Molly. I know. I won't let you stay. Good girl.
There is no stain uptake in either one of her eyes, so she does not have any scratches or ulcers. Alright, so after we've stained her eyes, we're going to go ahead and flush them out.
It's okay. Good girl. It's okay. 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 Good girl.
To calibrate your TonaPen, you want to do this daily before any usage, or if you get any type of errors, you want to calibrate your pen. So to calibrate, you want to start by holding your pen straight down to the floor. You want to tap the button twice. CAL has popped up, so it's in calibration mode. We're going to wait till it tells us to slowly turn it up. Now it says good, so the calibration is good. You want to push that button. Now you'll see dashes, which indicates it is ready to be used. So we are going to check eye pressures on this patient with our TonaPen. I'm going to go ahead and put some proparacaine in her eyes. And we'll let that sit for about a minute. Okay, after the minute, we are going to put a new tip on the pen. So her left eye is 11. We're going gonna do her other eye, and then we'll do this 3 times and take the average. Okay. And this one is 15. Anything between 12 and 25 is normal. So to perform an enema, you want a red rubber catheter, body temperature water. This water is at 101. We're gonna add some lube. Get your solution, attach the catheter. You want to flush the catheter so all the air is out of it. And with the dog in lateral recumbency, then you would insert it into the rectum slowly and gently, push your solution, and then tuck the tail, put her outside where she can walk around. Then you want to document that in the record, whether she passed stool or not. So in this video, we're going to be giving subcutaneous fluids to this patient. We have a new needle that is an 18 gauge, so the fluids will flow freely. Our lactated ringers and our patient. We are going to wipe her with an alcohol swab. You want to pick an area that has some extra skin.
Stay. Hang on.
And we changed our needle. And with the bevel up, you want to tint the skin. Good job, baby. And then she's getting her fluids now, and you can put a pressure bag on it that will squeeze the bag, or you can hang it from a higher level and just let it drip on its own. And then you want to continue these until the prescribed amount is given. So to apply a modified Robert Jones bandage, you want to first make sure you have enough materials and that you cover enough area above the wound. So if she had a wound on her foot here, we would want to make sure that we go up a joint above and a joint below if possible. You do want to try to keep the toes out, so you can keep an eye for swelling and temperature and things like that. So you want to get your 1-inch tape that you're going to use for stirrups. You want to have your elasticon or vet wrap here. If you're using vet wrap, you want to go ahead and unroll and re-roll lightly so you don't have the tension that is too tight whenever you apply it to the leg. You want to have your tongue depressor to keep between the sticky sides of the stirrup so they don't get stuck together. You want to have cast padding and conforming gauze. So to start, you're going to have your patient lie down. If you have a wound, you can also use a Telfa pad. We'll go ahead and use one for her So you want to take your tape, make sure you're not putting it over the wound, but you want to keep it halfway on the limb and halfway off. Take your tongue depressor, keep it on the bottom of the limb, or the bottom of the tape, excuse me. And then do the same thing for the other side of the limb. Then you would apply your telfa over the wound. Then your cast padding, you want to start over the telfa, work down distally towards the toes. And then work your way back up proximally. Stay. And whenever you are overlapping, you want to overlap half of your previous wrap each time. And you can do a few layers of this. Then you want to apply the conforming gauze. With this you want to start at the toes, at the distal part of your bandage, and if you do it the opposite way that you laid the cast padding, it will help it stay longer. This you want to make sure, since this is conforming gauze, you want to make sure it's snug but not too tight. And you want to make sure that your cast padding has a little lip, so you're not bringing your conforming gauze over the edges of your cast padding. And this is the same thing, you want to overlap 50% of the previous wrap. Then once you have your conforming gauze on, you can put your stirrups on. Now you can place your vet wrap. This one you want to start distally at the toes and work proximally. Then you want to apply elasticon or some type of tape halfway on the bandage and halfway on the fur. And then wherever your wound is on the patient, you want to put some kind of label there, whether it be a sticker or a heart or a big X, so whenever the bandage is removed, you're not in any risk of affecting the wound or anything like that. You would remove the bandage at a different area. To remove the bandage, you want bandage scissors. You do always want to start proximally and work not like up towards the skin, in case you get wrinkled skin and your scissors snag. You want to go with the tension of the skin. So we would remove hers with our bandage scissors. They have a blunt end. With the blunt end, you would start proximally, wiggle the blunt end between the skin and the bandage, and then cut in small increments all the way down, and then you can peel the bandage off. But here is your modified Robert Jones bandage. Now for a splint application, you follow the first few steps of the regular bandage. You want to do your stirrups. We'll go ahead and do that with our tape. And our tongue depressor. Stay. Stay. Stay down. Lay. If there's a wound present, then you would put your Telfa pad on, being careful not to put your tape over the wound. Then you would apply your cast padding. For the splint, you want some extra padding between the patient's limb and the actual splint, so we're going to use at least 5 layers of cast padding. Once the limb is adequately padded with cast padding, you can go ahead and place the properly measured splint. Make sure you have an edge of cast padding that extends beyond the edge of the splint. Then you want to do your clean gauze. Once your layer of cling gauze is on, then you can apply your stirrups. in an ideal world, this would be a little shorter and not extend past her toe. I would trim this to where her toes are still sticking out, and that's not what she's walking on. I do not have the materials to do that, and this will be removed in about 2 minutes. After your stirrups are on, you want to go ahead and place your vet wrap. I've already unrolled it and re-rolled it so the tension's not too tight.
Oh, you're so good.
Once your vet wrap is on, then you can put the final layer of tape, preferably elasticon, around the limb to keep it secure. You do want to have the toes where you can see them for swelling and temperature. And that is how you would properly place a splint on a rear leg. Then you could remove this whenever it was ready. Since you have a splint on, you're gonna have to manually remove this most of the time. If you had used elasticon versus vet wrap over the splint, then you could use something to cut down the length of the tape so you could peel the tape off, or have the dog lay on the opposite side so you can have access to the medial surface of the leg, and then you could use your banded scissors proximally to distally as well to cut through the cast padding and vet wrap and all that other than the splint. Now for the removal of the bandage, you want to locate the wound if there is a wound present. Hopefully there's a marker on the outside of the vet wrap or elasticon, whatever you used for the bandage. You want to avoid that area with bandage scissors. With your scissors you would start proximally and advance the tip distally slowly after you wiggle it to make sure you are not snagging on skin or anything like that. You want to make sure you're between the skin and your actual bandage. Or you can manually remove your bandage as well if your patient allows it. Remove your tape. And your vet wrap. you can remove the stirrups, and your clean gauze.
Oh, you're very good.
And then your cast padding. And you can gently remove your stirrups from the patient's limb. And if you had a telfa, you would remove that as well. So next we're going to apply an emergency bandage, like if she popped sutures open from an abdominal surgery. You want to unroll your vet wrap first and then re-roll it so the tension is not too high. And then apply your telfa. Roll some cast padding. Mm-hmm. Then you do a layer of conforming gauze. Thanks. Hold it. Then you would apply your vet wrap.
No, it's so weird.
And then secure it with either elasticon or porous tape.
I know. Good job.
And that's how you would apply an emergency bandage for an abdominal wound. Okay, so I'm going to take dental radiographs on this patient here. With our dental plate, we're going to take her incisors first. We have it the flat side facing up. I'm gonna make sure all of her incisors are on the plate. Then the x-ray head, we're gonna move down close to her snout. And then we will walk outside of the dental room to actually take the x-ray so we don't have our PPE on because we're gonna be outside of the x-ray. So we're gonna actually shoot the x-ray now. We're outside of the room so we don't have PPE on, but we have all of our settings here. We're gonna hold this down. So here's her actual x-ray, and that is a good shot of the incisors. Okay, the next x-ray we're gonna take is gonna be her first premolars. So we want to have the plate here at an angle. You want to make sure you get the roots on the x-ray. So it looks like the roots will be exposed to the plate. If you needed more angles, you could use some gauze or anything underneath the plate to put it at a different angle, but hers looks okay. We're gonna move the x-ray head. Okay, and we'll go ahead and shoot the x-ray. And here is the view that we took, which does show the crowns and the roots and her bones. So that looks pretty good. The premolar one, it looks like the roots have a little bit of bone loss there. So there are a lot of different dental instruments, and they all have different functions and different methods of applying them to the tooth. So we have molar extracting forceps here. After you split a molar, you can then remove each root of the molar with these extracting forceps. Then we have our tartar extracting forceps. So this, you would just crack tartar off of individual teeth. This is a probe that has a depth explorer here that has separate little measurements here that you can put down into the gingival pocket and measure exactly how deep it goes. And then on the other end is a pointy sharp end that's called an explorer. You can explore around the tooth and explore pockets as well. This little sharp end will catch on any kind of divots in the tooth or imperfections and things like that. Then we have our hand scaler, like the manual scaling instruments. This has a little pointed end here that you use to scrape tartar above the gingiva, and then this is a separate end that is also angled as well, and it's almost like the little explorer on the other side, but it's not as sharp, and this is to get in the crevices of the teeth. And then we have our curettes. There's a bunch of different kinds of these. This is also used either subgingival or supragingival, and you can specifically use these at certain angles to get tartar off of the teeth. Then we have our tartar scrapers here. They have like cutting edges on them. They're almost the shape of like a cutting edge needle that you can actually scrape tartar off of the teeth. And then we have our elevators. So if you were to extract a tooth, they come in a bunch of different face sizes. We have large sizes and small sizes. Some of them have different angles as well that your doctor would use to elevate the tooth so they can extract it without breaking the roots. Alright, so for this patient, we're going to go ahead and hand scale his teeth. We have our sickle probe here, and this shows that it is for above the gum. We're going to take it at an angle and just easily scrape as much as we can off, and then we will do the ultrasonic scaling as well. And you don't want to use the wrong kind of scalers. There are specific ones that are supposed to be on the actual tooth, and then the gum line. And we'll go ahead and use our ultrasonic scaler here. We're not going to touch the tip to the tooth at a 90-degree angle. You want to keep this just on the side. You want to start at the tip of the tooth and work your way up just with light pressure. And you don't want to stay on the same tooth for more than about 5 seconds. And then once you are done with the ultrasonic scaling, we will polish. You have your prophy paste here. You can use it as like a little ring if you want to, or just dip your little cup in it. You want to get plenty of polish, and you want to use a low setting. If your polisher has different settings on it, you want to use the lowest one. You want to start always wearing eye protection because this is going to sling everywhere. Your patient does have eye lube. And we will do this on all teeth. Each individual tooth you can only do for about 1 to 3 seconds because this will burn the tooth as well. So the purpose of using the prophy paste after your dental cleaning is to smooth out any imperfections caused by the scalers, and it can also knock off any residual plaque that you missed. For the clip of the dental procedure that you just watched, I do want to mention that the patient did have a piece of gauze in the back of the throat to prevent water going down the throat and then causing aspiration pneumonia and any kind of debris getting stuck back there. I did want to mention that after polishing, you will rinse the teeth and make sure all the polish is gone after that step is completed as well. So for dental care at home, you have a bunch of different options. First, you want to probably start out with like toothbrushing. You can start out with your finger or like a rubber kind of thing that goes over your finger. You always want to use pet toothpaste, not our toothpaste. You can also get toothbrushes that you can use. You want to just kind of gently go over all the teeth. Don't scrub really hard up on the gums. We also have options for water additives. This is probably the easiest thing that you can use. This goes just straight into the water in the bowl. Okay. Some pets don't like the way it smells, so you'll have to really watch and see if they're actually drinking the water. Have a bowl with additive in it and a bowl that's fresh so they don't go without water ever. Then you have chews. These are actually impregnated with like the Chlorhex scrub that we would use for surgery and things like that. Okay. They have a antibacterial in there that you can chew. They disintegrate, so they're not going to block your patient or have to worry about them getting an exploratory surgery. Then you have dental diets that you can feed exclusively as their diet or just as treats. Most people will use these as treats and then separately with a regular diet, but these are made to withstand the actual chewing mechanism, and it's not going to break apart as soon as they chew it, so it actually scrapes that tartar off. So you have a lot of different options here for dental care at home.
Awesome, thank you.
Yes.